Hey everybody, Dr. Luke Stringer here, Advanced Health Chiropractic down the South Loop of Chicago. Very common question we get asked from our patients, do I need surgery? Essentially, I say to all of our patients who ask us that question is, always try conservative care before you go the surgical route. Why? If conservative care works, then you don't need surgery. You have surgery, you've had surgery. Unfortunately, spinal surgery, the outcomes aren't great. 72 to 80% of the time you feel the same and or worse. If you've had a spinal surgery in the low back, you're 5 times more likely to have another one. So if you need surgery, it's always that option. However, I always say keep your gunpowder dry per se in regards to try conservative care first. So what is a really common surgery gets performed on the spine is due to disc injuries. Essentially when we have big traumas like car accidents or really poor posture, when the disc becomes damaged and that disc fluid starts shifting into the nerve canal, that can create a lot of pain and dysfunction. There's several surgeries, discectomy, laminectomy, essentially where they go in, they cut you on your spine, they scoop out the disc fluid. We have ways of essentially addressing that through chiropractic techniques such as flexion distraction, adjustment and spinal traction. I'm going to show you a technique called flexion distraction, which is really effective for treating disc injuries, and we've helped many of patients that have been recommended surgery to not get surgery due to addressing a dysfunction in the spine, both mechanics and alignment. Alrighty guys, so if you've got a disc injury, you've been recommended surgery, it's more than likely due to that disc fluid shifting into the nerve canal, compressing the nerve, creating a lot of pain and dysfunction. This technique is called flexion distraction. You simply pin the joint and you take the joint through flexion extension, which is what we're doing right here. When we do this, it creates a vacuum in the joint, which pulls the disc fluid into the central part of the disc, takes pressure off the nerve and cleans out the nerve pain that's essentially causing the dysfunction and recommended surgery. It's a really effective, non-invasive technique that can actually improve the disc within the spine. Dr. Kennedy's going to lay on the left side. After we flexion distraction, we want to adjust that joint, motions, lotion, stimulation in the disc creates nutrients to be sent into the disc. Nice job this side. So guys, if you're suffering with a disc injury and you've been recommended surgery and you want to give conservative care a go, I highly recommend you reaching out to us. Hopefully you find this information useful. If you're watching on Instagram and Facebook, like, follow the page. If it's on YouTube, subscribe, turn on the notification bell. We look forward to providing you with some awesome content soon.